Здравейте и добре дошли! Днес ще отидем в съседна Румъния, за да ви срещна с мой колега и приятел, доктор Люшън Поп. Последните няколко години имах шанса и късмета да работя с колеги от Тимишоара и Букурещ по различни проекти. Целта на днешното видео е да ви покажа как работят в една от големите държавни болници в Букурещ. В Букурещ има 3 големи болници. Това са Филантропия, Александреско Русеско и Университетската болница. Това са 3 болници, в които специалисти по фетална медицина извършват прегледи, консултации и фетална хирургия безплатно за своите пациенти. Искам да ви покажа каква инвестиция е направила държавата в една от тези болници, с каква апаратура разполагат, обучението на кадрите и много ще се радвам да ви е интересно видеото с доктор Поп. Приятно гледане! Сега обещаното интервю с доктор Люшън Поп от Букурещ, Румъния. Люшън, it's a great pleasure to have you here with me. So, will you tell us more about your hospital?
Hello Slaviana, and thank you very much for coming to Bucharest. It's an honor and a privilege to have you here, such a distinguished doctor like you, which I have known for many, many years. I would like to say a couple of words about our hospital, which at the moment is one of the biggest maternity in Romania. Usually we have around 3,500 deliveries per year, and we have the biggest preterm department in the whole Romania. Basically, approximately 20-25% of our babies are being born preterm. Some of them are very early preterm baby, less than 25 weeks, 24 or 25 weeks. During the pandemic, this was an extra burden for our hospital because we had to work as a mixed hospital, COVID and non-COVID department. We had 2 places for COVID patient, but they were not enough because at one moment we had like 7 or 8 patients at the same time, so we had to squeeze them all over the place. Overall, we had more than 160 COVID delivery patients.
Were the majority of them delivered by C-section?
Yes, majority of them were delivered by cesarean section. In many cases, it was a iatrogenic preterm delivery. We had to deliver the baby in order to help the mother to improve their condition and to improve their breathing function, respiratory function.
As we speak about cesarean section, what is the percentage of C-section in your hospital?
Unfortunately, our percentage of cesarean section has increased steadily for the last 50 to 20 years. Now it's around 60%. But when I started like in 2005, 2006, it was around 34-35%.
Why do you think is this trend?
This is not only one reason, there are more reasons for this one. One of them it is of course the medical legal reasons, because we have a lot of complaints. for vaginal delivery, not only in our hospital but across Romania. And doctors, in order to avoid this, they have a very low threshold to perform a cesarean section during labor. Secondly, a lot of women do ask for cesarean section from the very beginning, and it is difficult to change their mind.
Do you think they believe that it is the safer way to deliver the baby?
Yes, it is a safer way for them, but also let's think about it that if 40 or 50 years ago women used to have 5, 6, 7 children, these days majority of women have 1, 2, maybe 3 children. Basically for 7 or 8 children it was impossible to have cesarean section for all of them, but now they consider that for 2 or 3 children it's worth having a cesarean section. Also, this is a legacy for the rest of their life.
And let's talk now about the technique of the C-section. What kind of technique do you perform?
It's a funnel incision, and majority of doctors now they are performing the miskavladic because it's also less time consuming, it's less sweat consuming, and it's less bleeding, really, the miskavladic.
So you do use the miskavladic as well?
Yes.
Now let's talk about the antenatal care. Will you tell me more about the screening programs, what is covered by the NHS?
I believe that our hospital performs very well in terms of antenatal screening because this unit which we are now, it was opened in 2016 after 4 years of hard work, and it's a new investment of more than 13 million euros.
13 million?
Yes, they were accessed in 2012, sorry. And right now we're performing a combined screening test. In our hospital, combined screening test, it's free for everyone. We're using the Bram Cryptor machine. Of course, there are other hospitals who are using Roche, Cobas or Perkin Elmer, but we're using Bram Cryptor. And after that, we can perform amniocentesis, chorionic venous sampling, cord blood collection from umbilical cord. We have done it. We are doing karyotype from the miscarriage, and also aside conventional karyotype, which is free, which is covered by house insurance, we can perform microarray, which is paid by the patient, but is definitely lower price compared with the private practice prices.
And it is free for the patient, but what is the funding that you receive per patient?
The funding that you are receiving, so for one conventional karyotyping, it's around 100 euros.
And for the screening, combined screening
for the
test?
screening test, again, for the PAPE and beta ECG, alongside first trimester morphology, it's again 100 euros.
100 euros?
Yes.
And I saw that you have very nice E10 machines. So how many do you have?
We have one E10 machine and 48, which some of them have been in use for a very long time. Just imagine that you are performing 15-20 scans per day at least, which of them. And as I said, with the COVID issue, we had to remove some of these in other wings of the department, which now they are back. But hopefully very soon we'll be able to change this machine, because our next step is to buy a sequenciator, because we want to perform whole exomic sequence and whole genomic sequence as well for our patients.
Also in Bulgaria, hot topic is thrombophilia, inherited thrombophilia, and anticoagulant treatment. Is there like a fashion here as well?
I think it's like a trend. It's a trend. I didn't see this trend neither in United Kingdom, neither in Austria, but I see it in Eastern Europe, as you say, in Bulgaria, in Romania as well. Too many of the patients are on heparin when they already come to have their first trimester anomaly scan.
And do you think this heparin treatment is working?
Well, patient believes they do, and I did succeed in changing this perception to some of them, but not to all of them. Majority will keep going with heparin, because a lot of information is provided by different blogs, different websites, and it is not very reliable information. Some of the people that are providing this information are not even doctors.
Yes, it is true. We have the same problem in Bulgaria as well. And what about VBAC? I'm jumping from topic to topic, but
we have a protocol for VBAC in our hospital, but usually we do not recommend, and the reason for that for the VBAC you need resources. because every woman in 200 is going to have a uterine rupture. If you are giving her syntocinon, it's going to be like 0.8%, and if you are giving her some type of prostaglandin to induce her labor, it's around 2%.
And is it because the lack of midwives?
Midwives, they are not really trained, but also doctors are afraid of VBAC. And you know, it's enough one case to fail, as it might be a whole disaster for the whole hospital.
And what about induction of labor? What do you use?
We are doing the induction of labor, but usually what you are using the stripping membrane method. We do not have the prostaglandin propes because it's too expensive. It's around like 50 pounds, one of them. It's 50 pounds, it's almost 300 Romanian currency, which is a lot for a hospital. And you do not have the warranty that with that propes the patient will have a vaginal delivery. Some of them will end up with a cesarean section.
Yes.
And it's going to be worse. It's going to be an emergency cesarean section, not an elective one.
So as well as the C-section trend is going up, the induction of labor is going low.
It's going low, it is as always been. But we are inducing with stripping membranes, rupture of membranes with syntocinon. Depends on the bishop school.
What do you want to say to our audience?
First, I would like to tell them to trust their doctors. That's the most important. Doctors and patients these days is no longer a relationship of paternalism. It's a relationship of partnership.
Yes.
And patients have to be involved in any decisions that concern them or their baby. And I support that as long as those decisions are safe for both of them.
Thank you, Lushън.
Welcome.
It was a great interview for me.
Thank you.
Thank you.